Did you want to learn more about how vision affects our daily lives? Well, this is a great segment for you because that includes vision in the classroom, women in medicine, and careers for the visually impaired, and much more. Each week, you can be fascinated by topics that include and branch beyond medicine, provided by the PCVI Network. Tune in on Sundays at 3 p.m. on Facebook and YouTube. You can also search PCVI Network and the channel will appear on the search. New and exciting episodes hosted by Jolene Aristide will be posted weekly. You won't want to miss this. Trust me. We'll see you then. Hello, my name is Jolene Aristide, and I would like to talk to you today about vision in the classroom. First, I just want to thank everyone for tuning in today. So, have you noticed any children, or if your child has experienced a decline in their performance in school? Or are you that child or adolescent that has experienced a decline in their performance in school? Well, vision problems are amongst the most common in school-aged children. In fact, according to Prevent Blindness America, 1 in 4 school-aged children present with vision problems that later on affect their learning abilities and adjustment in school. So especially for a child, it's not fun to not be able to partake in activities just because you cannot see. So for parents and teachers and people alike, what are the signs that you can see in the child that can lead to a reasoning why they might need correction in their vision? If they're bumping into things at home around the area that are noticeable to you but not noticeable to them. If they complain of frequent headaches or rubbing their eyes frequently or eye tearing. Also, if they have to sit up very close to the TV, the laptop or iPad or anything of electronic device or even a book in order to see or read. These are all signs that can tell you that your child needs correction in their vision. So what can you do? The immediate response is to take them to get an eye exam. You can do that here at the Print Center, where there's an abundant resources that will help your child learn to succeed in school by impairing their vision. And also, we have a wonderful facility here where they will feel comfortable enough to get their eye exam. Thank you so much for tuning in today for this segment in Vision in the Classroom. And we'll have Dr. Prince also come in and tell you about his experiences that children have come into the center with vision problems and their vision has improved. Also, their success in school has elevated. Thank you.
Art facility with low vision specialists for all your vision needs. Our low vision rehabilitation specialist will accurately measure your visual capabilities and help you use it more efficiently. Please call us today for a low vision evaluation at area code 516-200-3850 or stop by our local office located at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580.
Hello, I'm Jolene Aristide, and we're back with Vision in the Classroom. So today we're going to talk about low vision. So students who have low vision or who are experiencing progressive loss of sight unfortunately struggle, as I have said before, with traditional reading and writing activities. This could be very detrimental to a student's capabilities as well as self-esteem and how they think their other counterparts perceive them, and how teachers as well may handle a student who has visual impairments. So a student with low vision, there are many different types of cases, and each case is different, each child is different, but low vision doesn't only affect children, it also affects adults. But today we're going to focus mostly on children because we're going to talk about the classroom setting. So, like I said, it varies from case to case. But all in all, I just want to make sure that there is a clear difference between low vision and those who are blind. Um, so, students who are blind and students who have progressive loss of sight, who unfortunately they're starting to lose their sight and they're not completely blind, and those who have visual impairments, they're all different types of things, but there are also different categories of low vision in and of itself. Today we have a wonderful specialist, a low vision specialist, who is going to speak about his experience in the field and dealing with students and patients who have low vision. And so today I have the great opportunity to introduce him. So Dr. Prince, what would you say in your expertise that you have experienced with students who have low vision?
Hey, thank you, Jaline, and I say thank you for having me in your show. Well, as for a student with low vision, as you know, Press Center for the Visually Impaired is a non-for-profit organization where
Yes.
we have our focus is on not only low vision but on student that lost their vision completely. What we say, student that's completely blind. That's all this to say to you. We receive a lot of students, that have not only visual impairment but also some other form of disability. When I say some other form of disability, they may have other senses that may be affected, like the hearing
Yes.
senses, or speech, stuff like that. Now, my experience with I have so many experience with a student with low vision, but the one that popped in my head is when her mom went her yesterday
Okay.
to a facility. This kid has what they call a disease called retinitis pigmentosa,
Okay.
and this disease is a form of disease where the kids cannot lost has some issue in one of the structure in the back of the eye that called in the retina that called the wood that's responsible for the light.
Okay.
Those kids most likely, you know, at night they cannot walk at night, even
Okay.
in the dark, and most likely they're always in the dark. And some of them even have what they call tunnel vision because
Okay.
their field of view is not that much. But the kids yesterday, I see she's a little bit functional, but the reason the mother, but she been seeing several ophthalmologists,
Okay.
several retinal specialists for the condition, but all the specialists said they cannot do anything for her and just send her home, take vitamin A, stuff like that.
Okay.
And now, bad for the mom, and it's like the mom just go home and without looking for any other place until and she finally that because I asked her where she heard about us. She said she
Yeah.
went to a barber shop, and that's when they talk about her to bring her daughter to the placenta,
Yes.
stuff like that. And that's when I look at her, with the vision she has, she still have some her central vision is not affected completely.
Okay.
That means her knee side is still good. That
Okay.
means she can do some work, stuff like that, except her distance view is a little bit affected. I said to her mom, and where you've been, because there is a lot of opportunity for your daughter. We can improve her sight. And she was, when the doctor or when a parent already bring their kids, in some place, so many places, they already say they cannot do anything. She said
Yes.
she said she doesn't know, but
Yeah.
whatever you can do, that would help, stuff like that. I said okay. And first, we do a functional vision assessment for the kids, and we see where she is at, and we see some of the low vision device that can help her. And guess what? She's supposed to go to school,
Yes.
and when I'm looking at the paper, because the mom explained to me she failed a test,
Okay. Yes.
at the
Yeah.
school before she get in, and I said to her, "How come you let the school give her a test like all regular student has?
Yeah.
You should
Yes.
say your kids has some form of disability." But she didn't know because she needed a letter from a doctor that can explain what the condition.
Okay.
I explained it to her. This test, for her to pass this test, she needs to use, some
Yeah.
low vision device. Most likely, I make the daughter sit down in front of CCTV is a low vision device. We we managed the contrast for her. She was able to read. She was excited. But
Awesome. Mm-hmm.
and the mom was already said, I want to buy. I said to her, wait, hold on. This is not what we do at the press center. That's why I'm just explaining to you the
Yes.
way
Yeah.
the community is so naive. They don't have enough information. I said, listen, this is one device that can help her. But
Yeah.
what we need to do, I need to
Build.
help her see a, but because she born like this,
Okay.
she doesn't experience like some other
Right.
kids that only
Okay.
that didn't have the vision before,
Yes.
and now they lost it. I said, let improve her vision, because
Okay.
us, like, we born with our 20/20 vision.
Yes, that's
We
true.
learn by imitation. We
Yes.
see what everyone do. We can see, but those kids that born with limited vision, they didn't have that chance.
Right.
I said, let's see how we can improve the vision. Let's she need to let teach her some visual skill that can help her see better, upgrade her field of view, of vision, stuff like that. And it take me time to explain to her, I understand you want to buy the device,
Yes.
but your daughter can see better without the device. That's the difference, and I'm glad you invite me to your show specifically for kids. This is one of the kids I was of so many cases.
Yes.
I have where the people came think you just go to a doctor and the doctor give them glasses or the doctor give them any form of device and that's it. But and reality is not only that, because you have to evaluate the kids, you have to rehabilitate the vision. That's what matters. And now, because you asked me a big question, I can talk to you about a lot of other kids
Yes, I
and that's
appreciate
sent
that,
to our
yeah.
practice from the Commission for the Blind. But those kids are kids that already get served by some other agency.
Okay.
Some other agency already send a lot of vision specialists to their house, like a O&M, Certified Orientation Mobility Specialist, or Vision Rehabilitation Therapist. They already get a lot of services. But guess what? Those kids, although they get all these services, their goals, because all these services just help them live with their condition.
Okay.
But a lot of these parents want the vision of these kids improve.
Okay.
That the different. When we get those kids, when they come to our practice, and stuff, a lot of stuff they could not do, we ask them to bring whatever the assignment they try to do, they cannot do. Whatever a lot of stuff they would love to accomplish, they cannot do. When they come to our practice, we able to make them they able to do all these things. That make the difference. That can sometimes even put the counselor in a difficult spot, because the
Yes.
counselor would say to us, well, this kid already served. The kids will say, well, I want to come to the presenter, stuff like that. It's not like we're just talking about the presenter. It's just like, so many kids,
Yes.
has a lot of potential. It's just like they don't have the information.
Right.
And they don't have the information, or even they think the ophthalmologist can do everything, or the optometrist can do everything. When you go, if you have based on your eye condition, if the ophthalmologist cannot do treatment to eye drops or surgery, and they will send you home.
Yeah.
Now the worst part is now the ophthalmologist need to understand, like a kids that have retinitis pigmentosa, a kids like this, even they cannot do anything, this kid can be successful in life
Exactly.
if they can send them to a low vision rehab facility.
Right.
And some of, even whatever the condition, because it's not like if some of the low vision device doesn't work, we can evaluate the kids and see the potential of the kids and even offer them some other form of communication they can learn, stuff like that.
Yeah.
I don't want to take your show
No, I think this is
forever, but
great insight. And honestly, coming from a low vision specialist himself, the case by case examples are very important for people to hear. I think it opens a lot of people's eyes to see that, this is so much bigger than just going to a specialist. It's rehabilitation. It's keeping up with, the techniques and knowing how to use those tools that you can use at the print center, and just getting in there consecutively and forming a habit and those habits leading to success in the classroom. It's very important. So I thank you so much for joining me in this show for now, and I'll see you soon. Thank you very much.
No problem, Julian. If you allow me, I would say to, I don't know, many parents try to get their kids go to Nassau Community College, and they give them the same form like they give this mom. And like this mom that came yesterday, she said, well, just give her large point. But what she doesn't understand, the kids has what they call retinitis pigmentosa. So not only the wood structure, the wood part of the retina is affected, which prevent her to see light, but the cornea is affected, which give us some contrast issue.
Okay.
You know, because sometimes they can give a large print based on the contrast, the color, or they give it to her, she may not be able to read it.
Yeah.
That's why, you know, stuff like CCTV, that's when they need a specialist that can help them, guide them.
Exactly.
You know, that's one of the things whenever you get to this situation, is best don't jump to conclusion. Sometimes get some advice.
Yes.
Look for where you can get help that can help you with this condition.
Yes, exactly. Explore your options, you know. If you feel like you need to further investigate your child's condition, and you think that it's more serious than just, you know, giving them a pair of glasses, and then you need to, you know, further investigate other doctors and other specialists. I think that's very important as well. Yes. Yeah, so thank you so much again for coming in. Again, he is a low vision specialist, Dr. Prince, here at the Prince Center. And we'll see you soon. Thank you so much. All right. So now, what is it that the child might need in order to better their ability to learn as a low vision student? So things like high intensity lamps and book stands and stuff and things of that sort. It's very important for a low vision student to use those things and be able to read the words clearly. And based on the specialist, based on their condition and what they're diagnosed with, that can vary. So that's why it's so important, as Dr. Prince just had said, that you go ahead and get the further treatment and the further care for the student, because each case is very different. You might your child might get a pair of glasses, and the problem is so much bigger than just a pair of glasses. You know, they might have a serious condition. So in order to you know, better your child's ability to learn and their overall health as well and their self-confidence, just continue to take them to rehabilitation. And you could go ahead and do that in the Prince Center as well. And also at the Prince Center, if the condition is far worse than just a visual impairment, or the student is progressively losing sight, they can learn how to use Braille. And it's another form of communication, as well as reading, that the student can use to help read, you know, assignments and activities and things of that sort, and learning letters if the child is younger, because again, there's such a broad spectrum. You know, vision doesn't have an age that, you know, it unfortunately they lose their sight at. There's no specific age where a child just you know, is more unfortunately prone to diseases and stuff of that sort. So if you have that child, or if you are that student watching, I would say definitely look into your resources, look into different specialists. So in terms of Braille, so Braille is just it's dots that represent letters or words that protrude out of the page, and you can use your finger to follow along, and it helps to you know, get that self-confidence from the student. Again, you know, you can read without using your sight. You know, your intelligence is not questioned, you know, because you cannot see. You know, that may be your impairment, but that will not restrict you from reaching your goals and your dreams. So it's actually more efficient for a low vision student to be able to adapt to a computer setting and using computer resources and programming that are geared to students with visual impairments. Now that can vary, the programming and the computer techniques and stuff of that sort can vary based upon the case. So if a patient is low vision, or and again, there's different low vision cases, and if the child is losing their sight progressively, that's different programming, different computer skills. But it's vital, very, very vital, that the child gets accustomed to using the computer skills. Like touch typing. You can get them into a touch typing course, that allows them to assess the letters on the keyboard, and anything that has to do with texture, touching, and things of that sort, like maps that protrude out on the floor that they can use to touch and learn the different states and stuff like that. So low vision, just because you may have low vision, or your child may have low vision, that doesn't stop their academics. In fact, they can overcome it, and they can excel even further or at the same rate as their peers. And also, I want to say you can also use computer magnification here at the Print Center, and they can get accustomed to those types of techniques and that equipment that they can also use at home to practice and do assignments, and they can also use in the classroom with an aid, because most schools do provide those resources and other schools do not. But if you're in the case where your school doesn't, you can come here and go ahead and receive rehabilitation and treatment, and you can get accustomed to all of these techniques so that you can go ahead and feel like a confident student and understand your activities, understand your homeworks, and be able to excel at whatever grade level you are. Because unfortunately, it only gets harder. The workload only becomes more intense as you go from elementary to middle school or high school, and even further if you decide to pursue further education. So you want to get your child started early if you have detected visual impairment or vision loss. You want to get them ready to use those computer resources, touch typing, and all that sort of techniques. Get them accustomed to it, because the best age is around 6, 6 years old, that they can really absorb those technological resources. So that's gonna help them further advance in their life and in their future careers. And you want to set up your child in the best way possible to excel. I'm pretty sure that's everyone's goal, is that their child excels whether they have a disability or an impairment or not. So again, I wanted to thank Dr. Prince for coming onto this segment today and speaking about his experience in low vision. And I want to thank all of our viewers. Thank you so much for watching this video. Again, if you have any questions or any comments, go ahead and just comment below, or you can go ahead and contact the Print Center. Or if you're a student or a parent of a student with vision loss or visual impairment, you can go ahead and come to the Print Center and get a evaluation and start your rehabilitation to further your success in your academics. Thank you so much, and I'll see you again soon. Bye. Did you want to learn more about how vision affects our daily lives? Well, this is a great segment for you, because that includes vision in the classroom, women in medicine, and careers for the visually impaired, and much more. Each week, you can be fascinated by topics that include and branch beyond medicine, provided by the PCVI Network. Tune in on Sundays at 3 p.m. on Facebook and YouTube. You can also search PCVI Network, and the channel will appear on the search. New and exciting episodes hosted by Jolene Aristide will be posted weekly. You won't want to miss this. Trust me. We'll see you then.